Hello, everyone. This is Faye. And of course, you know that I sell Medicare plans. Sometimes I think that's my last name. We are recording, and this is Module 1 of the 2025 Ahip lessons. Will everyone please be sure that you are muted? There is someone who is not muted, and I'm not sure. But as we're going through, it will make it so much easier for everyone else. If you are muted, I will go through the lesson for Module 1. I will point out those things that are very, very key. And this is the way the process works. If you were not with us last year, every evening this week, because there are 5 modules, and that includes Thursday, July 4th, we will be doing a module. When the recording is done and the module is complete, I'll stop the recording and you'll be able to ask any open questions. So make sure that you have pen, paper, your tablet, or whatever you take notes from to keep those notes, and we can have an open discussion. If it is longer than an hour, it's okay. However, most of these trainings are expected to be, including the Q&A, about an hour. There are some sessions that are a little bit longer than others. For most of you who are here, you've done this before. So modules 1, 2, and 3 will probably go pretty quickly because those are your general ones. If there are any questions, you can also put them in the chat. We're starting on the very first page where it is the login. So for those of you who have already gone in, logged in through a carrier or directly to ahipmedicaretraining.com, you are ready to follow each of the modules. For each module, there is a transcript and there is information that you can download. If you feel it's necessary, go ahead and do that. Throughout the training, you will probably hear those little dings because as people come in, I will make every attempt to pause to let them in. We want as many people to be able to take advantage and ask questions as possible. So I have actually gone into Ahip and paid the $125 because I went through Devoted. Devoted was the first carrier to put their certifications online, and Ahip came out on the 24th. Devoted put their certs out on the 25th. So I went through Devoted, went in through the certification site, the recertification site, and am now logged in or can log in to the Ahip. If you have any problems on how to log into Ahip, you can ask those questions as well. So I'm logging into Ahip. Can everyone see my screen? If you can't see my screen, then unmute yourself and let me know. So everyone can see the screen. So we're going to proceed. In each of the modules, you're going to see the same thing at the very beginning. There's going to be instructions, and you will always start here with 2025 Medicare training. Mine will be recertification. For those of you who have taken this for the first time, it will be certification. Now, I've already completed module 1, and I did that so that you could see what happens once you have completed the module. There's a check mark that will show up. So I've completed module 1. I've done the practice test at the end of module 1, scored 100. So that's done. I don't need to do module 1 again, but I'm going to go back through it because this is where we're starting. So every night, when you're done tonight with module 1, you can go ahead, take the practice test, and take the practice test as many times as is necessary, because it doesn't count against you at all until you have every one of the, I think it's 20 questions, answered correctly. If you can answer each of the practice questions correctly at the end of every module, then you're definitely going to pass the final exam. Okay, module 1. You can see that my score has already been taken and it's done. So now I think I'm going to have to go back to get to the beginning of that lesson. Hopefully I can get into it again to show you. Okay, here we go. This is what module 1 is going to look like. It looks like it's not going to let me do this. So I'll have to go this way. Okay, in each one of the modules, you will have these 4 choices. The 01 is for previous and next buttons. The 02 will be required to view each slide. 03, click the menu icon up at the left-hand corner. And 04, you can download materials by clicking the download slides. At the bottom of each slide, there's previous and there's next. So you'll have to go through next. The course will not allow you to skip. You'll have to go slide by slide. But by going through the training tonight, hopefully you won't have to read each slide because we will have already done that. That will save you a lot of time. Is someone having a problem with their mic? The terms and the conditions for each module are going to be the same. The training is protected by the United States copyright laws, so we're not trying to take this program and change it or alter it or use it in any other way than to become Ahip certified. In this first course, module 1, the learning objectives are the different ways that you get Medicare benefits, eligibility and coverage under Part A and Part B, original Medicare premiums, help for beneficiaries with limited income, and combining original Medicare and Part D. Now, let me tell you that we're in 2024, So the numbers that are going to be shown for Medicare premiums are going to be 2024 premiums. And they're usually noted within the course. They will change later in the year. Most often the new for 2025 numbers will come out right around when we're able to start Ahip around October 15th, or at least by November 1st. So in Module 1, our roadmap says we're going to do Medicare program basics, original Medicare eligibility, enrollment, entitlement, and premiums, help for individuals with limited income, Medicare Part A benefits and original Medicare cost sharing, Medicare Part B, original Medicare, and Medigap coverage. Those are the 7 things that we're going to cover in Module 1. Medicare program basics. Medicare is the federal health insurance program for individuals who are aged 65 and older, and for younger individuals who have certain serious health conditions or are disabled. Medicare eligibility does not take into consideration an individual's income. However, individuals may pay higher premiums based on income, and low-income individuals may be eligible for assistance. Individuals can receive their Medicare medical coverage directly from the federal government, which pays for services on a fee-for-service basis. That's original Medicare. That's your red, white, and blue Medicare card. Or they can have their Medicare medical coverage through individual private health plans. Those are your Medicare Advantage plans. Individuals must receive their Medicare Part D outpatient drug benefits through the private health plan, even if they get medical coverage through original Medicare. So the only way that they can have a Medicare Part D plan is through one of the private insured plans. Medicare coverage is often known as the part of Medicare law under which it is authorized or regulated. Part A is referred to as hospital insurance benefits. Part A also covers inpatient care, skilled nursing, rehabilitation services, and hospice. Part B is referred to as supplementary medical insurance benefits, and Part B covers a broad range of outpatient services such as physician care and drugs that are administered by physicians or other healthcare professionals, such as vaccines and intravenous medications. Part C regulates and authorizes Medicare Advantage plans, which cover Part A, except for hospice, and Part B benefits. Individuals enrolled in the Part C plan can still get hospice benefits, and that's because if someone is diagnosed for hospice care, the benefits are then paid by original Medicare, even if they're in a Medicare Advantage plan. Part D covers prescription drug benefits. Or self-administered drugs. So those are the ones that you pick up at the pharmacy. They're not the Part B for boy drugs that are administered by physicians or other healthcare professionals. These are drugs that you administer to yourself, or the Medicare beneficiary would administer to themselves. So they're picked up at a pharmacy and then they're taken at home, and they're regulated by the Medicare prescription drug plans. Medicare Part E, this is a separate part, not A, not B, not C, not D, but E. This is a lesser known part of Medicare law. The Part E regulates other miscellaneous programs, including Medicare cost plans, which also cover Part A and Part B benefits. Most of us throughout the country don't have Medicare cost plans, but they do exist. Medicare cost plans are only offered in a limited number of states and are most frequently found in rural areas. So when you see Medicare Part E, or you have a question about Part E, yes, there is a Part E to Medicare. And it includes the Medicare cost plans, the Medicare supplement plans or Medigap plans, and also the programs for all inclusive care for the elderly, which is also known as PACE. There are different ways that beneficiaries can choose to receive their Medicare coverage. Original Medicare, Parts A and B, can be combined with a Medicare supplement and or a Medicare prescription drug plan, a standalone prescription drug plan, what we know as PDP. Medicare Advantage plans are the Medicare Part C health plans with or without a Part D benefit. So they could be an MA, Medicare Advantage, without prescription drug, or an MAPD, Medicare Advantage plan with prescription drugs. Someone could also choose to only have a Medicare prescription drug plan and original Medicare without a supplement. They could self-insure everything that the supplement covers if they choose to. That's a choice. Medicare cost plans is a way that they may receive their benefit if there are cost plans available to them in their area. PACE plans, again, they have to qualify for that all-inclusive care for the elderly if there's a PACE plan available. And then, of course, there's the Medicare Medicaid, which we know as dual plans. People have both. Medicare and Medicaid, they can choose a dual option. So this is a chart that shows the different ways that you can get Medicare. So across the top, Part A and Part B benefits, some of the cost sharing for Parts A and Part B, Part D benefits, and other benefits. So if someone is using original Medicare, they're only going to have Parts A and Part B. They don't have anything else. If they choose Part C, they have benefits of Part A, Part B. They have some cost sharing, and they may have prescription drug plans. That's your MAPD plans, or they may not. And they may also have those additional benefits, the dental, vision, hearing, the gyms, and the cards, and all those other rewards. For cost plans, someone has Medicare Part A and B benefits. They have some cost sharing for the Part A and B benefits, and they could have a standalone drug plan to add to the cost plan. And some cost plans will have some additional benefits as well. If someone chooses a Medicare prescription drug plan, the Part D, then that's the only piece that they're going to have. However, to get the Part D prescription drug piece, you either have to have A or B, or be eligible for B. Original Medicare with a supplemental plan, that would be Part A and Part B under Original Medicare, having a Medicare supplement or a Medigap plan, and the Medigap plan would cover some foreign travel in emergencies that Original Medicare does not cover. The PACE plans would include the Part A and Part B benefits, some cost sharing, a Part D benefit, and may include adult daycare, some meals, and some other benefits. Medicare, Medicaid plans, those are your dual plans, would include the benefits of Medicare Part A, Part B, may or may not have some cost sharing depending on the level of Medicaid, does always include the Part D, and integrates with Medicaid for benefits. Now, this is a chart. If you have not gotten into Ahip yet, you may want to take a screen. You may want to take a picture of this chart. So I'll give you a few moments to look at the chart, take a picture of it if you need to. Okay, original Medicare eligibility, enrollment, entitlement, and premiums. In this segment, the original Medicare covers only Part A and Part B benefits. That is your red, white, and blue card. Part A benefits include inpatient hospital, skilled nursing, facility. It includes hospice and home health care services. Okay, I'm going to go back. I didn't give enough time for you to get the chart. Okay, here's the chart. Are we all set? I'll take a screen print so that if I have to send it to someone, I can. And each of you you're gonna see this when you go through your actual Ahip. And as you're clicking through, because you don't have to read each slide because I read them to you, when you get to that slide, you'll have an opportunity to take it again. Okay. Original Medicare covers only Part A and Part B, and Part A includes inpatient hospital, skilled nursing facilities, hospice, home health care services. Part B includes outpatient and professional services, such as those provided by a doctor or non-physician professional, like a nurse practitioner or a PA, physician assistant, clinical lab services, durable medical equipment, preventive services, and other outpatient medical services. Under original Medicare, beneficiaries can receive covered services from any physician or facility that accepts Medicare anywhere in the United States. So with original Medicare, there's no carrier network, there's no in or out of network. The provider just has to be able to accept Medicare. And anywhere in the United States, you could use original Medicare. There are no referrals required under original Medicare. No network, no referrals. To be eligible for Medicare Part A and B, an individual must be age 65 or older or be under age 65 with certain disabilities or health conditions, including all who get disability benefits from Social Security or certain disability benefits from the Railroad Retirement Board for 24 months. So once someone is totally disabled as determined by Social Security and accepted by Social Security, and they have collected benefits for 24 months from Social Security or Railroad Retirement, they are eligible for Medicare. Individuals with ALS, often referred to as Lou Gehrig's disease, or individuals with end-stage renal disease are also eligible for Medicare, and they're going to be eligible at a much sooner time. They don't have to wait the 24 months. And there's a slide in here that gives you the time frame for the end-stage renal disease. Each person to be eligible for Medicare must be a United States resident and be either a United States citizen or be an alien who has been lawfully admitted for permanent residence and has been residing in the United States for 5 continuous years before the month of applying for Medicare. So people who are just coming into the country are not eligible for Medicare. They don't meet any of those requirements. Individuals with end-stage renal disease, individuals with end-stage renal disease, those are the people that you know who are on kidney dialysis or who are waiting kidney transplant and they're going through dialysis. They generally lose eligibility 36 months after having the kidney transplant, unless the person is already eligible for Medicare due to another basis, like age or because of another disability. So someone who gets Medicare because they're on kidney dialysis. If they have a kidney transplant, 36 months after the transplant, they lose the Medicare unless they're already 65 or they have the Medicare because of another disability. However, such individuals may remain enrolled in the Part B Medicare only for coverage of immunosuppressive drugs if they have no other health coverage that would cover the drugs. So those are drugs that kidney transplant patients must have in order to sustain life with the transplant. And those are Part B, B for boy. It's not a drug they can pick up at the drugstore and administer themselves. It's a drug that's administered by a professional. So if they have no other way of having those drugs covered, they can continue to have Part B. We're continuing enrollment into Medicare Parts A and Part B. Some people are automatically enrolled in Parts A and B, subject to the Part B exception below for people who are in Puerto Rico. Individuals who are already getting benefits, so you know the earliest that you can start to collect Social Security retirement benefits is age 62. So someone who is currently receiving Social Security or railroad retirement benefits will automatically be enrolled in Part A and Part B starting the first day of the month that they turn 65. If their birthday is on the first day of the month, then it's the first of the previous month. These individuals are also allowed to refuse Part B if they need to, because remember, Part B has a premium, so it is elective. So they will be automatically enrolled, but if they don't want to get Part B at the time because they have credible coverage someplace else, perhaps an employer plan, then they can refuse the Part B when it is automatically assigned at that time and pick it up later when their credible coverage ends, as long as they do it within 6 months of the time that the credible coverage ends. Individuals with disabilities who are under age 65 are automatically enrolled in Part A and Part B the month after they have received disability benefits for 24 months. However, they also have the opportunity to refuse the Part B coverage. We would never suggest to someone to refuse Part B coverage unless they have other creditable coverage. Individuals with, I can never pronounce this, so I'm going to say ALS, also known as Lou Gehrig's disease, get Part A and Part B automatically the month their Social Security disability benefits begin. Individuals living in Puerto Rico are not automatically enrolled in Part B. They must sign up for Part B. Other individuals will have to sign up that they want to be enrolled in Part A and Part B. We've just gone through the people who will automatically be enrolled. Individuals who are close to 65 but are not getting benefits from Social Security or railroad retirement may sign up for Parts A and B during their Part A, Part B initial enrollment period, which begins 3 months before their 65th birthday, including the month they turn 65, and ends 3 months after. There is a consequence of failing to sign up for Part B when initially eligible, and that'll be covered in other parts of the modules. Individuals with end-stage renal disease may sign up for Medicare at any time. However, the date on which their Medicare coverage begins is usually the 4th month after dialysis treatments begin, but may be earlier if certain conditions are met. This is a question that usually is on the test. Remember when someone can get Medicare who is on dialysis. 4 months, usually 4 months, the 4th month after dialysis treatments begin, but can be earlier. Individuals eligible for premium-free Part A can sign up for Part A anytime after they turn 65. Their Part A coverage starts 6 months back from when they signed up, but cannot start earlier than the month that they turn 65. If they have not signed up by the time they apply for Social Security, they will be automatically signed up and coverage will be retroactive for 6 months. Individuals who do not enroll in Part B or Part A, if they have to buy it when they are first eligible, can enroll during a general enrollment period. The general enrollment period every year is January 1 to March 31. Coverage begins the first day of the month following the month in which the beneficiary enrolls. This is a change. For many, many years, for those of you who have been through this for some years, you remember general enrollment was always January 1 to March 31, and it became effective July 1st. Well, now, as of this year, it's January 1 to March 31 for the general enrollment period. However, coverage begins the first day of the month following the month in which the beneficiary enrolls. So if they enroll in January, it's February 1st. February is March 1st. March, it's April 1st. Individuals who have group health plan coverage based on their current employment or employment of a spouse may enroll in Part A if they have to buy it, or Part B anytime while covered under the group health plan during a Part A, Part B special enrollment period. This occurs the 8-month period immediately following the last month they have group coverage. So someone who is coming out of a qualified group health plan that had credible coverage has 8 months from the last date that they were in the group coverage to apply for A and B and without a penalty. Individuals who are eligible for premium-free Part A can sign up at any time. There are also Part A, Part B special enrollment periods that allow individuals to enroll after the Part A, Part B initial enrollment period due to issues such as emergencies or disasters in their area. Most of us have seen disasters, FEMA, special elections. We've seen disasters, flooding, fires, all of those different. People also can apply when they're released from incarceration. They can apply because of loss of Medicaid, and they can apply when the health plan or employer made an error that caused them to miss their initial enrollment period. Medicare Part A entitlement and Part B enrollment. And an individual is entitled to Part A if they are eligible for premium-free Part A, or if the individual has enrolled in Part A and continues to pay the premium or have the premium paid on their behalf. An individual to enroll in Part B and remain enrolled in Part B, the individual must pay the Part B premium or have the premium paid on their behalf. Employers can pay the Part B premium for an employee. So other ways to get Medicare. This is an overview. To get Part C, the individual must be entitled to Part A and enrolled in Part B and reside in the Medicare Advantage plan area. To enroll in Part D, an individual must be entitled to Part A or enrolled in Part B and reside in the plan area. I can't ever make those things close. To get a cost plan, the eligibility must be entitled to Part A and or enrolled in Part B. If they're not entitled to Part A, they will not have coverage of Part A benefits under the cost plan, and they must reside in the Part D plan service area. To be eligible for Medicare and Medicaid plans, individual must have both Medicare and Medicaid, meet eligibility requirements specific to the state, and reside in the plan's area. For PACE plans, individuals must be age 55 or older, be certified as eligible for nursing home care by their state, be able to live safely in a community setting at the time of enrollment, reside in the PACE organization's service area, meet any additional program-specific eligibility conditions imposed under the plan's PACE program agreement. Medicare premiums Part A. Most individuals are entitled to Part A without paying a premium. For individuals aged 65 or older, you're entitled to premium-free Part A if you or your spouse have worked and paid Medicare taxes for at least 10 years. All individuals eligible for Medicare due to disability, end-stage renal disease, or Lou Gehrig's disease are eligible for premium-free Part A. For those individuals who do not automatically qualify for premium-free Part A, the monthly Part A premium in 2024 is $505 for individuals or their spouses who paid Medicare taxes for less than 30 quarters, $278 for individuals or their spouse who paid taxes for 30 to 39 quarters. And of course, if you have 40 quarters, then you get it free. Individuals who are not eligible for premium-free Part A and those who don't buy Part A when they are first eligible may pay a late penalty of 10%, up to 10%, unless they enroll during a special enrollment period. They will have to pay the higher premium for twice the number of years they could have had Part A but did not sign up for it. This you should pay attention to because it is different from the penalty that you pay if you don't have Part D for David. It's also different if you don't have Part B for boy. So pay attention to this one. The Part B premium for 2024 is $174.70. And most people pay the standard monthly premium. However, some people will pay more based on their income as reported to the IRS 2 years prior. So 2 years prior, they may have been working, had high income. That means this year they're going to pay more than the standard $174.70. As they get into retirement and they have less income, they can apply to have that changed. This is the chart, and this might be another photo moment. You're going to go through this whole thing so you can take a picture of the chart when you get ready to do Ahip and keep this as a reference for people whose income as an individual is greater than $103,000 in 2024. Their Part B premium is $244.60 instead of $174.70. And if it's a joint tax return and their income is greater than $206,000 to $258,000, they pay $244.60 each for their Part B premium. That's each person. The payment mechanisms and penalties for Part B. Part B premium may be deducted from Social Security check, railroad retirement check, or Office of Personnel Management civil service annuity checks. If an individual doesn't get any of these checks, then they will need to pay by receiving a bill every 3 months from Social Security. Employers may pay monthly Part B premiums on behalf of their retirees. For individuals who do not enroll in Part B when they're first eligible, the Part B premium is increased 10% for each full 12-month period the beneficiary could have had Part B but did not enroll. This is known as the late enrollment penalty. The exception from the penalty would be individuals who have group health coverage based on their current employment or the employment of a spouse, and they are not subject to the premium increase penalty if they enroll in Part B anytime while covered under the group health plan or during the special enrollment period, that is that 8-month period when the group health plan ends. In addition, individuals enrolling during any other SEP are not eligible to the penalty. Here are some examples there are 2 examples for the Part B premium. Example 1, Mr. Klein is a Medicare eligible retiree who did not enroll in Part B because he had health care coverage through his wife's employer. His wife is planning to retire soon. Mr. Klein can enroll in Part B at any time up to 8 months after the month in which his wife retires and his coverage ends under the group plan If he fails to do that, then he will be subject to the Part B penalty. Example 2, Ms. Stein retired when she was 65, but did not enroll in Medicare Part B after her group coverage ended because she was healthy and thought that her Part A benefit would cover catastrophic costs. Ms. Stein is now 72 and wants to get Part B because her doctor's bills, lab tests, and vaccines are becoming expensive. Ms. Stein will have to pay the monthly Part B premium plus an additional 10% for each 12-month period since her group coverage ended. This obligation will continue for as long as she has Part B. Help for individuals with limited income and resources. Beneficiaries may receive help to pay for Medicare Part A and B premium, the Part A and Part B deductibles, cost sharing, and or some Part D prescription drug costs. Beneficiaries may apply for the following programs using their state Medicaid office. Every state has different rules for Medicaid. The Medicare Savings Program helps pay for Medicare Part A, Medicare Part B premiums, and in some cases helps with deductibles and cost sharing. The Qualified Medicare Beneficiary, also known to us as QMB, is one type of Medicare Savings Program. The QMB enrolled in Medicare Advantage plans also get help with their Medicare Advantage cost sharing amounts. Part D, low-income subsidy, also known as extra help for paying for prescription drug coverage. Prescription people interested in Part D should call the Social Security office or apply at ssa.gov. Extra help isn't available in Puerto Rico, U.S. Virgin Islands, Guam, the Northern Mariana Islands, or American Samoa. Medicaid is help with healthcare costs not covered by Medicare, such as custodial and long-term care. Persons who do not qualify for the Part D low-income subsidy, but are of limited means may qualify for help in paying Part D drug costs through a state pharmaceutical assistance program if there is one available in the state. Agents should encourage beneficiaries with limited incomes and resources to call or visit their Medicaid office and ask for information on Medicare savings. That would be 1-800-Medicare or the state health insurance assistance program. Medicare Part A benefits and original Medicare cost sharing. Medicare Part A provides coverage for 1, inpatient hospital care, including care provided by acute care hospitals, critical access hospitals, inpatient rehab facilities, and long-term care hospitals. It also covers blood, covers up to 100 days of home health care after an individual is in the hospital. Note that Part B covers home health care without a prior hospital stay. Part A only covers the skilled nursing after a 3-day inpatient hospital stay. And also note that Part A does not cover inpatient hospital, blood, or all of the 100 days without some cost sharing. It also covers skilled nursing and rehab up to 100 days, but only after the 3-day hospital stay. I've already told you that. The inpatient psychiatric care has a lifetime limit of 190 days. And Medicare Part A covers hospice care. Original cost sharing for inpatient hospital. In 2024, beneficiaries pay the following amounts for inpatient hospital care. $1,632 deductible for each benefit period. A benefit period begins the day an individual is admitted to the hospital or skilled nursing and ends with an individual has not received hospital or skilled nursing care for 60 days consecutively. Days 1 through 60, there is no cost sharing except for the deductible, the Part A deductible. Days 61 through 90, it's $480 per day for each benefit period. And 91 through 150 is $816 copay per day. And those are lifetime reserve days. So the lifetime reserve days are days a beneficiary can use after they've been in an inpatient hospital for 90 days. Once those are used, because they're lifetime, they cannot be reused. Beyond the lifetime reserve days, if someone is still in the hospital, Medicare Part A is paying no other benefits, and the individual has the full cost. In 2024, Medicare beneficiaries pay the following amounts for skilled nursing. Days 1 through 20, there's no copay for each benefit period. Those visits are separated by the 60 days. The days 21 to 100, which is the maximum day, it's $204 copay per day. And after the 100 days, if they're still there, the cost belongs to the individual. Medicare Part B. Medicare Part B generally covers physician and other healthcare professional services, outpatient hospital services, clinical lab, diagnostic tests, x-rays, MRI, CAT scans, durable medical equipment, home health care that's not covered under Part A because the individual was not in a hospital or skilled nursing preceding the home health care. Physical and occupational therapy, ambulatory surgical center services, chemotherapy provided on an outpatient basis. And again, these are not payable at 100%. Ambulance services, chiropractic services, opioid use disorder treatment, preventive health services such as vaccines, mammograms, smoking cessation, and counseling, diabetic supplies, kidney dialysis, outpatient mental health care. There are some limits to the mental health care, virtual check-ins using video and audio technology, and CPAP devices are all covered under Part B. There is a $240 annual one-time deductible for Part B under 2024. So there is a Part B deductible. After the deductible, the Medicare Part B pays 80% of Medicare approved expenses, and the beneficiary has 20% except for preventive services where the individual has no cost sharing. These are things not covered by A or B. Healthcare while traveling outside the United States, cosmetic surgery, custodial long-term care, outpatient prescription drugs. This is under Part D, so it's not covered by A or B. Most dental care. However, Medicare may pay some dental services, and those would be dental services that are caused by a disease or injury to the mouth or tissues of the gums of the mouth, not necessarily the teeth. Hearing aids are not covered Massage therapy is not covered. Eyeglasses are not covered by Medicare. Concierge care is not covered. And covered items or services provided by a doctor or provider who has opted out of Medicare, except in the case of an emergency, are not covered. Original Medicare. Appeals relating to original Medicare benefits Part A and Part B. Beneficiaries receiving Part A and Part B through original Medicare have a right to appeal Medicare's coverage and payment decisions. Beneficiaries must file an appeal related to an A or B services within 120 days. Remember that was one of the questions that I had. Beneficiaries who believe their hospital, skilled nursing facility, home health agency, comprehensive outpatient rehab facility, or hospice services are ending too soon have a right to a fast appeal. Their provider will give them written notice before the end of their services. The notice tells them how to ask for a fast appeal. Beneficiaries must ask for a fast appeal no later than noon of the first day after the day before the termination date listed in their notice of Medicare non-coverage. If a beneficiary disagrees with the appeal decision, they have 180 days after getting the decision to request a reconsideration by a qualified independent contractor. Additional levels of appeal may also be available depending on the amount of controversy. Beneficiaries may also file complaints about medical providers. These are called grievances. For example, a beneficiary may have a complaint about unprofessional conduct by a provider, improper care, unsafe conditions, abuse by a provider, long waiting times, or unclean conditions. Instructions for filing grievances can be found on the Medicare.gov website. Or they can call you and you can always direct them. Additional beneficiary protections under original Medicare. Medicare operates a 24-hour helpline at 1-800-Medicare. Beneficiaries can use this number to find out about their claim status, coverage and benefits, premium payments, or ask other questions about Medicare. Beneficiaries can also get assistance with Medicare, including help filing an appeal or grievance through their local, state health insurance assistance program. Original Medicare Part D prescription drug plans. A beneficiary in original Medicare may receive Part D prescription drug coverage through a standalone prescription drug plan, generally, except for those duly eligible for Medicare and Medicaid. Medicare beneficiaries must actively select a Part D plan. Beneficiaries who enrolled in a Part D typically pay a monthly premium, an annual deductible, and then a per prescription cost sharing. In selecting a Part D plan, beneficiaries should consider expected premiums and cost sharing, formulary, and network pharmacies. So it's not just about which is the cheapest monthly premium, it's overall cost. Here's where you can get more information. Centers for Medicare and Medicaid Services, CMS, Medicare.gov, the Medicare and You Handbook, and your Medicare Benefits Handbook. Medigap coverage. The Medigap plans are sold by insurance companies, and the Medigap insurance or Medicare supplements work only with original Medicare. It is illegal to sell a Medicare supplement or a Medigap plan to someone already in a Medicare Advantage plan. Medicare supplement insurance is sold by private insurance companies to fill the gaps of all those deductibles and co-insurance that we were just talking about that's Medicare does not cover. That's why it's called Medigap. Some Medigap policies cover limited benefits not covered by Part A or Part B, such as extra days of coverage for inpatient hospital care, foreign travel, emergency care. Generally, the Medigap plans or the Medicare supplement plans do not cover long-term care, like care in a nursing home. They don't cover vision or dental services generally. They don't cover hearing aids or eyeglasses or private duty nursing, generally. Medigap policies are available in standardized benefit plans identified by letters A and N. However, different plans are offered in Massachusetts, Minnesota, and Wisconsin. States determine which standardized benefit plans may be offered in their state. So some plans may be offered in some states for Medicare supplements, but they're not offered in other states. Some states have guaranteed issue for any of the plans they offer. All states don't have that. Turning age 65 and signing up for Part B triggers a 6-month Medigap open enrollment period when the insured can receive a supplement, a Medicare supplement plan, regardless of any pre-existing conditions. This is called the guaranteed issue right. In certain limited instances, leaving a Medicare Advantage plan may trigger a guaranteed issue right. Issuance and sale of Medigap or Medicare supplement plans are regulated by the state, so they can be different from state to state. Some states have additional guaranteed issue rights. Some have specific requirements around marketing Medigap and Medicare supplement plans and requirements concerning commissions. And the commission structure for Medicare supplement is in no way, doesn't look anything like the commissions that are established by CMS for Medicare Advantage plans. All Medigap plans pay for some or all of the following costs. The Part A coinsurance coverage for 365 additional hospital days for Medicare covered hospitalization. Part B coinsurance or copays, blood, the first 3 pints, and hospice care coinsurance or copayment. Beneficiaries with Medicare supplements plans H, I, and J offer non-Medicare drug coverage. These plans are no longer sold after January 1, 2006. Some beneficiaries may still have them with the drug coverage that they had before January 1, 2006. If they leave those plans, there's no guarantee that they can go back to them. Individuals who are enrolled in Medigap plans may only obtain Medicare drug coverage through a standalone prescription drug plan. To enroll in the Part D, the individuals who have Medigap plans H, I, or J may keep their Medigap coverage with their H, I, or J with the drug portion, or they can drop that and take another Medigap plan and do the standalone prescription drug plan. If the Medigap policy credible prescription drug coverage, the beneficiary may have to pay a late enrollment period. Having credible coverage means that the Medigap policy's drug coverage pays on average at least as much as the Medicare standard drug coverage and gives the same value as the Part D, D for David plan. Medigap rules for individuals who become eligible for Medicare after December 31, 2019. Individuals who attained age 65 on or after January 1, 2020 are no longer eligible or first become eligible for Medicare due to age, disability, or end-stage renal disease on or after January 1, 2020 may not purchase a Medigap plan that pays the Part B deductible. So generally Plan C and Plan F are not available to anyone who becomes eligible for Medicare after January 1, 2020. This is a chart of all the Medigap plans, and it tells you what's covered and at what percentage. So you have plans that range quite a few alphabets. Again, when you get to this slide, if you feel it's necessary, you can take a picture of it or you can Google it. It'll come up as a slide anyway. The thing to remember about Medigap plans or Medicare supplement plans is whatever the plan offers, it follows, and that's why it's called supplement. It follows original Medicare. If original Medicare doesn't pay for it, except for the 15% excess, the foreign travel, those things, except for those things, if Medicare doesn't pay for it, the supplement is not going to pay for it. For more information on the Medigap plan, you can call Center for Medicare and Medicaid Services, CMS, or look into the Medicare and You handbook. Okay, then you're at your final exam. So we've gone all the way through the course, and this is where you would start to take, it says final review, and this would be your practice test. I am going to stop share and look at the chat to see what questions we have. Let me just stop the recording here, and tomorrow night we will go through Module 2 in the same way. When we're done, we'll be at the practice test where you can go in, do the practice test as many times as you feel necessary until you have every one of those practice answers correct. When you have an answer incorrect in the practice test, the test results will tell you it's incorrect and give you the correct answer. If you don't understand the answer, we can review it tomorrow.